So we're going to go over insertion and use, and then removal of a subcut line. You may see subcut lines being used in your facility. Oftentimes they're utilized in sort of a palliative care situation to administer meds to a patient so that they're not needing to be poked repeatedly. So this is what the subcut line looks like before it's inserted or taken out of its package. So before starting, you want to find an area on your patient that's appropriate for subcut med admin, essentially. And you want to make sure that that site is free of cellulitis, edema, irritation, open skin, anything like that. Just avoid those areas. The sites generally are rotated every 2 to 7 days and as needed based on your assessment of the site. Any redness, irritation, or pus, you'd want to change it, of course. And also you'd want to refer to your specific facility's policies on that. They might vary a little bit on when they need to be changed. But generally that 2 to 7 days and PRN is a good rule. So we'll go over how to insert it. You're going to want to clean your hands first, of course. We've selected our appropriate site on our patient here. We can maybe pretend that it's the side of their abdomen there, about 5 centimeters away from their umbilicus. We have our clean gloves. We have the supplies that we need, which I'll go over in a moment. We can open our package here. So I'll just kind of show you the anatomy of the device. So it's a line. As we talked about, it's kind of got this soft, flexible tubing. It's got a clamp on it here. At the end, you'll see where the needle eventually is withdrawn and where we are going to attach our syringe to. At the top, it's kind of got that butterfly format to it. One side has sort of grippies on it, and the other side is a little bit flat with a sort of a line across it. And then under the cap is the needle. So generally when we start, you're going to actually be holding it by these sort of grips, and once you kind of get your hands on it, you'll feel that it makes it a lot easier to handle that way. So we'll just put it back down in our container for now. We selected our site, like I said, and we're going to clean our site. Depending again on your agency's policies and procedures, you may be using plain alcohol swab, or you may be using a combination of a swab with alcohol and chlorhexidine in it for injections and insertions of lines. So we're going to clean our site really well. I'm going to make sure that we let it dry before, throw that out. We're going to apply our clean gloves before we inject or insert. You'll see on the table here I have a dressing for afterwards. We'll go over that. You can kind of prop that open for yourself. I also have a one-link system similar to the IVs, which I'll show you why we need that in a second, but we'll use that once it's inserted as well. So we'll say our site is clean and dry now. We're going to pick up our needle and we're going to grab it there on that grippy portion, like I said. We're going to remove the cap, and you're going to look and make sure that your bevel is going to face up. We're going to do our grasp of tissue like we do for subcut injections, and we're going to go in at that 45-degree angle. And you can probably imagine, as you know, you can sometimes go in at a 90 or 45-degree angle, depending on how much you can grab for a subcut injection. But because of the line system, we don't want to go in at that 90-degree because it would be sticking out sort of awkwardly. So we're going to stabilize. I kind of stabilize here with the side of my hand, and we're going to go in, bevel up at that 45 degrees, and then we're going to lay it flat here. And now with your device, there's usually a button sort of back here, and you press it and pull back, and the needle actually comes out and it's protected in here. This will go into your sharps container. You can't rethread it or anything, and we're just going to stabilize our system here. So make sure it's stable. We're going to apply our dressing. And you'll see the dressing, just like an IV dressing, it has a window here. We want to make sure that within the window we can see our insertion site really well, so that if something's kind of gone awry with it, or it's causing any irritation, that we can actually see that site on the patient. This doesn't always stick very well to the injection pad skin, so you'll just kind of have to imagine that on a patient it does actually stick fairly well. So there we go. If you noticed for some reason when you went in there was flashback, excuse me, of blood in the line, you'd want to remove it and start again, because that may mean that it's in a vein, which we don't want. And our next step is we're actually going to remove this, because if you look at this injection port, this is actually an older style. We don't really see much anymore. Where we used to use sort of a sharper system, it was still a blunt needle considered, but it would puncture through this to instill medications. Now, as you know, we use the Luralock system. The Luralock system doesn't speak to this, so we're going to switch it over to our one-link device there. So we'll remove here. So you don't need to, this one can just get thrown out because we won't be using it for anything. These ones come sterile out of the package, so you just want to be mindful of that. Pull off the blue portion. If you do happen to handle that yellow part, you should clean it with an alcohol swabber if you're not sure. So now you have your one-link system on here. And again, you don't have to pre-prime a subcut line, because a little bit of air is okay if it's not in a vein, like we said. So we are going to give it a quick flush. The maximum amount generally for subcut lines is 2 mLs at a time. So again, you'll want to check your site's policy on that. But generally they say a maximum of 2 mLs of medication, and then you can do a 0.5 ml normal saline flush after the medication. So we have a pre-filled sterile normal saline syringe here with 3 mLs in it. There's actually a little bit of overfill in this one. And we're just going to flush it with 1 ml here. So I'm just watching the amount. Good, and it flushes easily, and I'm kind of blocking it, but you want to keep a look at the site while you're flushing and ask the patient how they're feeling. It's a good idea before you start instilling the normal saline to kind of make sure that that plunger isn't sticky, so that when you do connect and start flushing, you don't have a sudden burst of normal saline, because that can be irritating or painful to the patient as well. So we've checked our site, it flushes well, we didn't get any blood return. We're going to throw these out. The patient tolerated it well. We're going to, a lot of facilities have a sticker, something like this, where it says, labels it as a subcutaneous line, and that this is not IV access. Because as you can imagine, you want to make sure that that's a clear delineation, because we're not going to give, say, the same amount of fluids or same types of medications through a subcut line. So you want to attach, you'd want to put the date and your signature on that, so then people know when it's due to be changed. Also would document it in the patient's chart, but so you can attach it here and sort of peel off that back part, or you can wrap it around the tubing if you take the whole backing off the tape, or the sticker rather. There we go. And so now we can access our line. So say you were giving medication to your patient via this line, for example, hydromorphone for pain control or dyspnea, again in that palliative situation. You're going to prepare your medication as you always would for subcut injection, minus the needle portion, right? Because they already have that set up there. So you're going to be doing your 5 rights 3 times, making sure you have everything you need, your MAR, you've done your assessments pre. You're going to come into the patient's room, and again, you're going to assess the site, again, doing all your checks. You're going to be cleaning this port. and you're going to be attaching your labeled pain medication to instill. And you're going to do it slowly and carefully, so again, not to blast it in to the patient. Before giving any subcut injections, as we know, we're going to check our parenteral drug monograph. That's the same for when we're using a subcut line. We want to check our parenteral drug monograph before. And remember, those same rules apply about the fluid volume maximums that this site can hold. So up to 2 mLs of medication, and then some sites say you can have an additional 0.5 mLs of a flush. So say, for example, you needed to give 2 or more subcutaneous medications and they're due around the same time, or needed around the same time. There's kind of a couple of options. You could have more than one subcutaneous line in the patient, or you could initiate more than one. An alternative is to wait up to half an hour after that first medication before giving the next medication. That half an hour ensures that it's absorbed and the site is then ready for the next medication. So yeah, that's pretty much the subcut site, how to insert it, how to use it, monitoring, etc. Okay, so I'm going to just go over the basic removal of a subcutaneous line in case you need to change it or remove it for whatever reason. So again, we're going to start with hand hygiene. Told the patient what we're doing. We're going to wear gloves in case we come into contact with a little bit of blood, but not likely really to have a lot. So then we're going to either stabilize here at the center or kind of here down at the hub, and we're going to pull off the dressing. Generally like to kind of pull off the border first, and once that's kind of up and out of the way, we're going to take a cotton ball or a 2x2 gauze, place it at the injection site, and remove our cannula here and dispose of it appropriately. And we're going to put, we could tape this. Generally it doesn't bleed a lot, but you just want to, again, monitor that site afterwards for any sort of irritation or excessive bleeding, hopefully not, and not likely. But we'll just monitor that site. Maybe possible infection, but again, not likely if the correct steps were followed in using the site. We're going to remove our gloves and perform hand hygiene, and that's it.